As you can imagine, having a diagnosis for a patient with a rare neurological disorder is essential, and genetic testing is the foundation of getting a genetic diagnosis. And recent new technologies, such as next-generation sequencing, have really revolutionized those approaches. However, the method is new, it's complex, so the different genetic testing laboratories can do it differently. And the principal purpose of our initiative was to align the best practices, check what the laboratories are doing, and if the results are of comparable quality. One of the surprises was that the laboratories actually do provide genetic diagnosis of very high quality, surprisingly high quality. But the other surprise, on the other hand, was also that really there is such a variability of the approaches. So if you go to one country, you'll get a different genetic report sometimes than if you go to another country. And of course, this is not optimal, so we found that there is still some work to do to harmonize this. We are now planning to develop recommendations, and those recommendations will actually cover all aspects of genetic testing, from recommendations on what is the best methodology and quality of genetic testing, recommendations on how to perform the interpretation of complex genetic data similarly across the laboratories, and also recommendations on how the reports should be prepared and made for the clinicians and, of course, the patients. Actually, this initiative has been initiated by the network from the beginning. And of course, the second benefit is also that we can offer this as a possibility for members of the network to participate in the quality assessment. But also now, when we have initial experience, we are including several partners of the network in the preparation of best practice guidelines. So the network is absolutely essential.